Hey guys, this is Kevin Budashevsky, and this is Mannitol. Osmotic diuretics work primarily here in the proximal convoluted tubule. Mannitol is the prototype of this class and is a sugar alcohol that's given intravenously. It's filtered freely by the glomerulus, but poorly reabsorbed from the tubule. As a result, it accumulates within the tubular lumen and generates an osmotic force that attracts water. This in turn causes the volume of urine to increase, resulting in osmotic diuresis, hence the name of the class. So, as is always the case with pathopharmacology, the way the drug works should tell you what some of the clinical uses are. Mannitol has essentially three clinical uses: to reduce intracranial pressure, to reduce intraocular pressure, and on rare occasions to help eliminate certain drugs or toxins from the body. In terms of the adverse effects, mannitol is well known for its ability to cause pulmonary edema. This is because the serum mannitol is transferred to the interstitial fluid and generates an osmotic force which pulls water from cells and into the interstitium. This can also cause dehydration because of fluid loss through diuresis. Can you imagine which electrolyte abnormality this can cause? What can cause something with sodium? Would it be too high or too low? Typically, you would think of this causing hypernatremia. Recall that sodium is an approximation of total body water content, and volume status reflects total body sodium. Therefore, if the volume is down, sodium is high. Some of you will have noted that first aid says that mannitol can cause hyper and hyponatremia. Remember that this is true for the test, but the pathophysiology of this is just well beyond the scope of the Step 1 exam. Additionally, mannitol is contraindicated in two different types of patients, both those who are anuric and those with heart failure. It's contraindicated in anuria because it's excreted by the kidneys and will accumulate in the blood without urine production. Can you guys guess why it's contraindicated in heart failure? Well, I'll give you a hint. It has to do with one of the adverse side effects that we already mentioned. Mannitol is contraindicated in heart failure because these patients are already at high risk for developing pulmonary edema. So what's the problem with mannitol building up in blood again? Remember, mannitol is osmotically active, which causes both diuresis and fluid accumulation in the interstitial space. On the exam, please look for mannitol being given during a neurosurgical emergency to reduce intracranial pressure. Also look for mannitol being given during an attack of acute glaucoma to reduce intraocular pressure. Alright, time for a flash quiz. In what two conditions is mannitol contraindicated? The answer would be anuric renal failure and heart failure. Remember that mannitol builds up, it can cause water to move out of cells, causing interstitial edema, which would be dangerous for an anuric patient or a patient with heart failure.